everyone, my name is Dr. Rahim and we have Bam Bam here with us today. I'd like to teach you and empower you how to recognize abnormalities in your pup so that we are able to ascertain whether there are any changes that may need medical attention sooner than later. The first thing that they teach us in vet school is how to differentiate what's normal from abnormal. So knowing your pup's normal is going to be very helpful in detecting diseases. Mama, look. Good girl. All right, so I always like to start off with from a nose to tail direction. So I always start off with the nose area. Is there any abnormal discharge? Look at the eyes. Is there any abnormalities there? Followed by the teeth. So I like to look at the canines all the way back to the molars back here. It looks like Bam Bam needs a dental soon, so I have to get that scheduled, okay? If the gums are really red, it tells me there's gingivitis, and if there's a bad smell coming from it, it means that there's some dental disease going on. So please schedule a vet appointment so that the veterinarian can take a look at it closer. Next would be the ears. Always double check for any abnormal smell coming from the ears, if it's yeasty, and if there's abnormal discharge. It should be nice and pink and free of any discharge, okay? Moving on, I go down the neck, making sure there's no discomfort and pain when I'm palpating down. And then I feel the rest of the body. Is there lumps? Is there bumps? Is there new lumps? Is there new bumps that shouldn't be there, that needs to be checked out? As I'm making my way down, down, come on down, good job. Bam, bang, bang. So you want to roll over for me? Oh, thank you. The next thing I tend to do is check the limbs. I extend them and I also flex it to make sure that there's no impairments in terms of the mobility. Check it all the way down to the level of the nails. It looks like Bam Bam needs a nail trim soon, okay? And then making my way down to the belly. Does the belly feel nice and firm? Does Bam Bam show signs of discomfort and pain when I'm giving a belly rub? Last but not least, checking the back limbs over here, flexing and extending. It should be nice and smooth. In our older patients, they may have a little bit of crunchiness. We know it in the medical world, we call it crepitus. So, and that is typically an underlying sign of arthritis or some level of orthopedic change, okay? If your pup yelps in pain, you see Bam Bam is kind of licking at it. It's just because one of her legs has received a surgery before. So she doesn't like this limb being touched as much. But it's so important that we are constantly feeling it for any signs of swelling or abnormalities. Last but not least, I take a look at the bum bum. At the butt area, is there any signs of infection going on back there? Is there any discharge going on back there? Because all of that will be helpful information to know whether I need to see the veterinarian or schedule one. As a general rule of thumb, I highly recommend really checking your pup. Just putting your hands. This does not take more than 5 minutes. As I speak right now, this is only 3 minutes long. So you can do it as well. And my hope and goal is that by empowering you with this information, we'll be able to detect diseases sooner and know when we need to see the veterinarian. Take care until next time. Bye.